During a screening mammogram, the mammography technician essentially takes at least two views of the breast, two pictures of the breast. They do need to compress the breast to some degree to get a nice view to see if there are any abnormalities. A 3D mammogram I would consider, from my standpoint, to be the standard of care at this point. It is shown to be more sensitive in that it will pick up breast cancers that may be hidden by your regular 2D mammogram. It also cuts down on what we call false positives. So that means if you get a mammogram and you're called back and the radiologist tells you that you need a breast biopsy, and you get the biopsy and it turns out to be nothing, the 3D mammogram cuts down on those numbers of unnecessary biopsies. So it really has two, I think, main advantages, and that is detecting cancers at an earlier stage and cutting down on unnecessary biopsies. It can also be extremely helpful in patients who have what we call dense breasts. So breast density has been associated with an increased risk of breast cancer. The tissue tends to look white on the mammogram, so it can be difficult to see some abnormalities. And 3D mammogram can be extremely helpful in picking up those obscured lesions as well. In addition to keeping up with your screening mammograms, it is very important to be aware of any changes that you notice in your breast and discuss these concerns with your primary care physician or a breast specialist. Oftentimes, really the best person to notice any changes in terms of a new sensation, a new lump or bump, or any skin changes is going to be the patient herself.